Okay guys, we'll do a quick summary about the squint. It is very important. So you are having heterophoria. No one is having orthophoria. Orthophoria means direct, both the eyes are 100% parallel. Okay. So now heterophoria determined is diplopia or phoria. How do you determine it is diplopia? You determine by, sometimes you can directly see and say the person is squint, or sometimes you need to see by a test known as Hirschberg's test. Okay. Phoria, how do you detect it? Detect by cover. Okay. What is the treatment here? No treatment required. Here we need treatment. Okay. Now treatment required. So what are the treatment? Before we start with the treatment, we should understand, find out, is it exo, iso, hyper, hypo. Okay, we should find out this. Alright, after we find out this, then we should also find out this diplopia is it concomitant or concomitant? Okay, concomitant or concomitant. How we'll find out? There will be no diplopia, only cosmetic issue. But in here the person will say diplopia, abnormal head position along with this vertigo and disorientation. Okay. Now what is concomitant? Concomitant means angle of the eye is always same in all the gazes, primary, secondary and tertiary. But in concomitant, angle of the eye is changing with primary, secondary and tertiary. The angle is never same. That's why you are having the symptoms here. Okay, that's all. Now we'll see concomitant. Okay, now concomitant, we will divide concomitant again. Concomitant will be divided into two types. Okay, that is it due to accommodation? Accommodative. You use retinoscope, you see that you need to give power, give glasses. If this is improved, that means this is accommodative squint. Do retinoscope, there is no power. Even if you give glasses, there is no functioning, no glasses helpful. With this, no glasses are helpful. So now what you will do now? Okay, there is only two techniques you can do. You need to do surgery. You do either recession or resection. Make the muscle stronger, make the muscle weaker. Okay, that's all you can do here. Now let us come to concomitant again. Concomitant is again divided into paralytic, okay, and restrictive. This paralytic is again divided into two. Is it due to nerve or neuromuscular junction disorder, that is myasthenia gravis, or due to third cranial nerve, fourth cranial nerve, sixth cranial nerve? Okay, so almost most of the common cause is due to diabetes and hypertension and sometimes trauma. So how do you know the third cranial nerve, fourth cranial nerve, sixth cranial nerve? Remember this: LR6 SO4 rest. So if third cranial nerve is involved, okay, these two muscles will be intact. Okay, and if the fourth cranial nerve is involved, everything will be intact except superior oblique will be affected. And if 6 is affected, all the muscles will be intact except lateral rectus will be affected. Function of lateral rectus will be gone, and function of in the fourth cranial nerve, superior oblique will be gone, and third cranial nerve, lateral rectus and superior oblique will be intact. Rest all the function will be gone. Okay, so remember, in this the picture will be down and out type, here up and in, and the sixth cranial nerve eye in, face out. This will be the picture. Okay, so how will we treat this one? Nerve issue one, we'll treat by treating the underlying cause, diabetes or hypertension. Carry out that. It will take you around 3 to 6 months, but this will have a significant diplopia, so you need to correct the diplopia. How will you? You'll be doing by patching, or prism or botulism toxin. Okay, you give botulism toxin to the stronger muscle to make it paralyzed. Okay, make sure you give to the stronger muscle. Okay, so in myasthenia gravis, how do you find out? You can do a gold standard tension test, and there are other symptoms. The doses will increase by at evening time. It will be more in females, and you confirm the test and you give the drug. You give the drug. So that's how you can treat. This was about a short quick summary about squint. Yes, squint. Remember squint, we need to know mainly two tests, which is Hirschberg's test and cover uncover test. Cover uncover test we find out for hidden squint, and Hirschberg's test we do it for, that is the squint that is visible to us, that is manifest squint. Okay, once we identify manifest squint, this phoria can become trophy in later cases, or sometimes due to binocular balance is tired, or you're not paying attention, you're emotionally unstable, you're crying, and this thing, that time this phoria sometimes belongs to tropia. Okay, in phoria generally you don't need to give any treatment, but tropia, yes, you need to give treatment. You need to know is it exo, iso, hyper. Along with this, you need to know is it tropia, what kind of tropia, is it committant or incommittent? How do you know incommittent? You will know that he'll say I am not having any diplopia, and incommittent having diplopia, abnormal head position, you'll be having vertigo and disorientation. Okay, if diplopia is there, you need to treat diplopia any technique. You give botulism, you give patching, or you give prism, but best is prism because it's cosmetically accepted. Now you know it's committant. Now you need to find out, is it committant due to not wearing the glasses due to diffractive error, or not because of how do you know? You use a retinoscope. You use a retinoscope, when you see power, you give the glasses and this is corrected, that means it was committant squint. Okay, you give glasses still not working, that means incommittent squint. So yeah, so the committant squint here, the treatment will be recession or resection or both, including these two both. Okay, whereas coming to the incommittent squint, paralytic and restrictive. Paralytic squint means there can be due to issue with nerve and the neuromuscular junction. Either nerve can be third nerve, fourth nerve and sixth nerve can be affected. Find out the function of third nerve is intact or not, fourth nerve is intact or not, sixth nerve. If one function of that muscle nerve that is supplying to that muscle is affected, that means obviously the muscle that nerve is gone. And neuromuscular junction, you find out myasthenia gravis and you treat the myasthenia gravis. So you will treat the underlying cause, along with that you treat the diplopia. That's all about the squint in a very short, and I made the previous video, you can check it out to understand the in depth. So that's all. Thank you. Bye bye.